Good morning. 30 minutes ago, St. Louis County's mask mandate was officially lifted after being in place for nearly 2 months. In its place is a public health advisory on the COVID level in St. Louis County and recommendations on protecting your health based on your circumstances. If you're at high risk for severe illness, talk to your healthcare provider about whether you need to wear a mask and to take other precautions. People with symptoms, a positive test, or exposure to someone with COVID-19 should wear a mask. And the new St. Louis County Public Health Advisory can be found on the county's website, stlouiscountymo.gov. Lifting the mandate comes as the CDC announced on Friday a new online tool to determine county by county COVID-19 community levels. The levels are low, medium, and high, determined by how many people with COVID-19 have been admitted into local hospitals in the last week, how many local hospital beds are filled with COVID-19 patients, and how many new COVID-19 cases the county has had in the last week. St. Louis County is at the medium level. Much of the new public health advisory addresses the new CDC guidance. Widespread availability of vaccines and testing, advances in treatment, and increased levels of immunity in the population through vaccination or previous infection have moved the COVID-19 pandemic to a new phase. To learn more about the new COVID measure system, go to cdc.gov. Last Wednesday, I announced that the county's mask mandate would be lifted today to give schools and businesses time to decide on how they want to move forward. School districts can set their own public health guidelines, and businesses can keep in place whatever protocols they feel are necessary to protect their customers and their workers. It's great that we're at this point. Warmer weather is just around the corner, and we'll be able to attend more outdoor events, some that have been rescheduled or canceled because of the virus. And with more people vaccinated, more people are comfortable gathering. We saw that this weekend at the Mardi Gras celebrations. Seeing the end of the Omicron surge is something to celebrate. Being at a place where we can move from a mask requirement to a mask recommendation is a great step. However, the end of the Omicron surge is not the end of the pandemic. But it is the end, hopefully, for a very long time of hospitals being pushed to capacities. Medical centers are breathing a sigh of relief while keeping a wary eye on the virus, which continues to hospitalize people every day. So I would not call this getting back to normal. That can never happen when this pandemic is responsible for the lives of nearly 950,000 Americans. We can't be like we were before, with so many lives lost and so many sickened by the virus. Livelihoods across the country were greatly impacted, and not all of that has been lost can be recovered. But we can rebuild, revive, and grow a promising future together. We continue to run a rental assistance program in St. Louis County that has helped thousands, and we'll have more to announce on the second phase of that program in the coming days that will allow us to serve thousands more. We have more than $80 million unallocated from federal funds from the American Rescue Plan Act, and we're seeking input from residents on how to best spend that money in St. Louis County. An online survey can be found at stlouiscountymo.gov. Just click on the Community Needs Survey icon. A series of virtual and in-person town hall meetings are being scheduled across the county. And as those details are set, we'll share that information with the press, on social media, and with our community partners so we can ensure that we can get as much input as possible. The infrastructure bill that the Biden administration got approved through Congress means millions coming to St. Louis County to tackle a long list of projects that have not had funding until now. And those projects will create hundreds of jobs. A settlement with drug distribution companies was finalized last week, meaning $458 million will be available to fund drug treatment and prevention programs in Missouri. St. Louis County will get about 10% of those funds to help our residents. And yes, St. Louis County is getting RAMS money. I have nothing new to report on this other than to mention that negotiations on how to split those funds will continue. There's no rush. The money's not allocated to anything, and we're fortunate to have in place unprecedented amounts of funding coming into St. Louis County this year. So if you want to continue wearing a mask, please do so. We know many people are not yet ready to toss them, and our youngest children are not yet eligible for the vaccine. Some people have health issues that make it hard for their bodies to push back against the virus. And some people just don't want to go into an indoor space where the status of others is unknown. So let's hope that there are no more variants to send us back into any type of restrictions. That is not a direction that we want to go. Thank you, and I would be glad to answer any questions.
Dr. Page, could you talk to me a little bit about Tim Fitch? He says that you don't have the authority to terminate the mandate since it was taken by a vote by the council. Says that the council would be the ones to terminate it. Can you talk to me a little bit about that?
The question is about a council member who believes that we can't terminate a mandate. We have had a long list of disagreements with several council members for the past few years about public health orders. Some of them have been litigated. St. Louis County's position has always held up in that litigation, and I just don't agree. Our health department doesn't agree with his interpretation, and that's all I have to say.
What should the takeaway be for people who hear this today? Dr. Page, should it be that COVID is on the way to being over, this is a step in the right direction? What do you think the key takeaway for people when they hear that the mandate is over should be today?
Well, the key takeaway is that St. Louis County has come a long way. Our vaccination rate's headed in the right direction, but it's not where we want it to be yet. Cases are coming down. Hospitalizations are still going on, but the rate of hospitalization is much less. So in general, the status of COVID is improving in our community. The number of people getting sick is improving, and the stress on our hospitals is improving. We're not out of the woods yet, but we're in a much better place, and we're at a place where, based on CDC guidance, that we can lift our mask requirement, but individuals should continue to look at their own health status and the health status of those around them and those they live with to decide on whether or not they want to follow precautions in certain settings.
I know that the health department has an advisory meeting coming up to talk about the vaccine incentive closeout. Can you speak on that a little bit? And I see our numbers of people getting vaccinated not increasing by much, so what's the plan there if there's possibly a closeout that's going to happen with the program?
The question is about health departments work in the community to get people vaccinated. I expect that their partnerships and conversations will continue. The amount of resources spent on vaccine education may shift, but I'm sure the health department will continue to work with community partners to try and get people vaccinated. Any other questions?
Yes. Let's see. There is another memorandum that was sent out by Tim Fitch talking about the weekly testing that they do, and they say they have anecdotal evidence from employees saying that they're not getting their test back within that 5-day window, and so it almost seems senseless for them to be getting tested weekly because they're not getting their results. Can you talk to that?
The question about employee testing moving forward will be discussed with the health department, and we'll decide whether or not we need to make any changes. I don't have a recommendation from the health department at this time. I expect that the council will talk about that some tomorrow too.
Dr. Page, do you have any, you mentioned it in your comments, do you have any timeline for when we might know anything about the Rams money?
No timeline, no.
Is there any requirement for when you have to have something done there?
A question about the Rams money and the requirement for the settlement. No, there's no requirement right now. We're focused on a lot of other things in the community, working very closely with the city of St. Louis on many partnerships, including the response to the pandemic. We just finished last week the opioid settlement, which was taking a lot of our time and resources in that negotiation with the Attorney General's office and opioid manufacturers and distributors across the country. So we've had a lot going on.
Do you envision a scenario where a mask mandate could come back?
The question is about a scenario where mask mandate would come back. It's hard to say. It doesn't appear like we're headed in that direction. I believe the variables that drive a mask mandate, infection rate and hospitalizations, are not headed in the direction where we would be concerned about that right now. The vaccination rate, although it isn't where we want it to be, is still a lot better than it was a year ago or even a few months ago. So all the things that drive a mask mandate aren't there. Who knows what the future brings next winter with another variant? We'll see. But I think we're in a much better place as a community and a much better place as a country in responding to the COVID pandemic.
You touched a little bit on the RAM settlement coming from up above. The question is, are you able to speak to where it's being kept, if it's losing money or if it's being invested at this point or gaining money? Some feel that it might be a little secretive as to what's really happening with hundreds of millions of dollars, and so I wonder if you might be able to speak to that.
The question about the RAM settlement and what's happening right now, it's currently being held in a trust.
Is that gaining or losing?
It's a trust. Yeah. No, we're not losing money in the trust.
Last question from me is about the federal relief funds for COVID. I know you have a survey for that. It's a lot of questions. So what kind of feedback or input have you received? And does the survey actually matter to the people that are taking it? Do the upper-ups really have the final say? Are they really considering what's being taken in?
So I'll try and find a question there. The question is about the survey. We don't have survey results yet. It's been in the community for a couple of days, and we'll let the survey run for 3 weeks. After the survey is done, then we'll have a process to compile that and interpret it, and then we'll provide that information to our county staff and our county council members. In the end, the county council members will determine the appropriation, and my administration will implement those programs over time. We have 3 years to appropriate the funds and 5 years to get them spent. Okay, thanks. Thanks, Jess.